So today's topic is neonatology. I am reading from Torontonotes 2025 version. Gestational age and size. So what is the classification of gestational age? If it is preterm, then 37-week less. So preterm called less than 37 week. If the baby is term, then 37 to 42 week. And what is post term? More than 42 week. Now classification by birth weight. If small gestational age, remember less than 10th percentile. And if large gestational age, remember more than 90th percentile. So what is the classification of preterm infant by birth weight? If low birth weight, that means less than 2500 gram. If very low birth weight, less than 1500 gram. If extremely low birth weight, less than 1000 gram. Now we will read about what are the abnormalities with the gestational age and size. If preterm infant, that means less than 37 weeks, the causes will be spontaneous. First, maybe idiopathic, we don't know. And then any maternal disease, hypertension, diabetes, any cardiac or renal disorders, this can happen. Fetal condition, multiple pregnancy, congenital abnormality, macrosomia, RBC, isoimmunization, fetal infection, maybe torch infection, pregnancy issue, placental insufficiency, placenta previa, uterine malformation, previous preterm birth, infection, placenta abruption. Any behavioral problem like smoking, alcohol, drug use, any psychosocial stressor, maybe intimate partner violence, or any abuse, socio-demographic factor, advanced age, low socioeconomic status. So these are the cause of preterm infant. So preterm infant, who are preterm infant? Less than 37 week, remember it. And with these, what will be the problem? The problem is RDS, respiratory distress syndrome, apnea of prematurity, neonatal chronic lung disease. It has another name, bronchopulmonary dysplasia, any feeding difficulty, then NEC, necrotizing enterocolitis. It is very important because they will say that necrotizing enterocolitis, what is the diagnosis, or they can ask in which child age group it affect. So it is affecting the preterm infant, necrotizing enterocolitis. And other problems will be hypocalcemia, hypoglycemia, hypothermia, anemia, jaundice, then retinopathy of prematurity, then intraventricular hemorrhage, ICH, I don't remember it now, and PDA, patent ductus arteriosus. So post-term infant, remember more than 42 weeks. What is their cause? So increased in first pregnancy, if the mother is first time pregnant, and previous post-term birth, and a genetic factor. So any condition, previous history is the first thing you should remember. Any infection, think of previous infection history. Any sudden infant death syndrome, think of previous sudden infant death syndrome. Any respiratory lung issues with the patient, again it can happen. So past history is very important with any disease. Then we are reading postpartum infant more than 42 weeks, and the problem are increased risk of stillbirth or neonatal death, increased birth weight, and fetal post maturity syndrome, impaired growth due to placental dysfunction, and meconium aspiration. Remember it, guys, it is very, very, very important. Meconium aspiration. When the baby is post-term, that means more than 42 week, uh, it is suppressing, and with the stress, baby aspirate the meconium. Baby first release the meconium and then aspirate the meconium. Now, small gestational age infant, less than 10th percentile, asymmetric, that means head sparing. Only the abdomen or other part are not growing well. What will be its cost? Small gestational age and asymmetric. Extrinsic cause is placental insufficiency, poor nutrition, hypertension, multiple pregnancies, drug, alcohol, smoking, familial factor, fibroid, maternal fibroid, and the problem of small gestational age. Perinatal hypoxia, hypoglycemia, hypocalcemia, hypothermia, and hyperviscosity polycythemia, immature RBC, and jaundice. Small infant, symmetric, early onset, lower growth. Intrinsic cause, maternal infection, torch, it is very important. Congenital abnormalities, syndromal, idiopathic, and the problem is patent ductus arteriosus. Large gestational age infant, more than 90th percentile, the cause are maternal diabetes, racial or familial factor, increasing parity, previous large gestational age infant, high BMI, obese mother, large pregnancy, weight gain, and certain syndromes. What are the problems? The problems are birth trauma, perinatal depression, that means meconium aspiration, respiratory distress syndrome, and transient tachypnea of newborn, jaundice, polycythemia, hypoglycemia, hypocalcemia. So, for large gestational age and term, transient tachypnea of newborn (TTN) is very important to remember it, because they can ask that when TTN occur or where occurs. So that means term infant and large baby, it can happen. Transient tachypnea of newborn.